Oh, good morning, everybody. Thank you for that wonderful introduction. I'm actually in Dubrovnik and at this moment in time, and I'm breaking with my vacation to be with you all today. So I do hope you will, feel for me as I'm coming out of the sun to present to you. My presentation today will cover basically the industry approach to supporting the safety of a food ingredient such as caffeine to food and beverages, including energy drinks. I will therefore be focusing on the GRAS, or generally recognized as safe process, looking specifically at the safety evaluation as it pertains to caffeine covering exposure, and I know this has already been a session this morning, and caffeine safety data. I'll also look briefly at some of the current international regulatory positions as they pertain to safety of energy drinks. So looking at the GRAS process specifically, this is a regulatory route as laid down by the FDA, as you all know, within the agency's rule on GRAS substances. Essentially, the GRAS status of a food ingredient is based on the views of experts qualified by scientific training and experience to evaluate the safety based upon scientific procedures. And this process takes into account both favorable and unfavorable information, and they have to evaluate both sides of the coin. So the GRAS status of an ingredient, such as caffeine, requires the same level of scientific evidence as is required to obtain a food additive approval from the FDA. The major difference between the GRAS process and the food additive route is that the safety data has to be generally available to the scientific community. This slide basically covers the technical requirements of a GRAS determination. And later in my presentation, I will be looking closely at the estimated human exposure of caffeine and how the incorporation of caffeine into foods and beverages, including energy drinks, is supported by the current caffeine safety database. So this slide shows some key aspects which support the rigor of the GRAS determination process. Importantly, it must be realized that the mere showing of safety is not sufficient. The use of the ingredient must be generally recognized as safe, and this is normally achieved through publication in peer-reviewed journals. GRAS requires consensus among qualified experts, but not necessarily unanimity. And such experts should be considered as being qualified, and by that I mean that they should be qualified to evaluate such information by the Food and Drug Administration. So moving on to the exposure analysis, and I know that you've already been through this in great detail this morning, and I shall skim over it, but the point I would like to get over here is that the safety evaluation process, this is a major component in the safety evaluation process, and so we need to take into account the daily human estimated intake from the incorporation of an ingredient like caffeine into various food and beverages. And probably, as you've already heard this morning, we tend to use the NHANES database, and this is if you look at the table, this was some numbers that were generated using the last two surveys, NHANES data surveys, dated from 2007, 2008, and 2009, 2010, and these were combined for statistical purposes. So as you can see on the right-hand side of the column, the mean and 90th percentile daily intake of caffeine from the background diet including supplements and energy drinks, at an incorporation level of up to 120 milligrams per 8 ounces. So looking at the right-hand column, as I mentioned, this equates to a value of 346 milligrams per day for the total population at the 90th percentile. The highest intake, which is also colored red, was found in male adults, and this was found to be 444 milligrams per day at the 90th percentile. And if you look at the left-hand side, you can see that these are background exposures. So looking at the total population, the background exposures from dietary caffeine in coffee, the 90th percentile intake is 342 milligrams per day, and once you've incorporated energy drinks, it really does not increase by very much. It also should be pointed out that the 90th percentile is an FDA benchmark for high consumers, and other than for male adults, all these values are below the 400 milligram threshold level that has been indicated by the FDA to be a safe level. I think it's also worth pointing out that the intake methodology generally overestimates exposure on the basis that it assumes all energy drink products in the marketplace have caffeine incorporated at the maximum use level, and assumes consumption on a given day is also associated with consumption of caffeine from other sources, including supplements, which may not be the case in a real-life situation. The NHANES Food Survey is also a short-term survey conducted over 2 days, which overestimates consumption over the longer term. And effectively what this does, this overestimate, is introduces a further margin of safety for the ingredient. However, although there are limitations in the methodology, when we look at some post-marketing surveillance data for energy drink consumption, it shows the exposure level of caffeine is similar to that generated by the NHANES Food Survey database process, and importantly shows the consumption of energy drinks in children and adolescents is low. These post-marketing surveillances are listed here and have been conducted by the FDA as well as on behalf of the International Life Science Institute. And I also want to point out the fact that there's been 2 surveys conducted in Quebec, Canada, looking at up to 70,000 teenagers in Quebec. And these 2 post-marketing surveillance studies really showed that the level of consumption of energy drinks in this target population was very low. I'd now like to move on to the safety data, and this slide shows the data information that has been taken into account to address the safety of caffeine through the GRAS determination process. This ranges from information from animal toxicity studies to how caffeine is handled by the body, looking at specific effects such as cancer, cardiovascular effects, seizures, as well as effects on children and adolescents. And as you can see just from this slide alone, there is a very large body of data on caffeine, and as such I will not be able to cover all of these aspects during my talk today. And as such I will just focus on some specific topics which I think are most relevant. So looking at the pharmacokinetics and metabolism of caffeine, the results in the literature indicate that the non-toxic doses in humans at levels up to and around 1 gram of caffeine does not result in any bioaccumulation, and the kinetics up to these doses appear to be follow a first-order process. Importantly, studies have demonstrated that naturally occurring caffeine in coffee is similar to that of anhydrous caffeine, which is added to products such as energy drinks, and these result in similar kinetics, as well as the fact that the major metabolites produced in humans are almost identical to those that have been found in rodents where the long-term studies have been conducted. And so, again, this supports the fact that these types of animal studies are good animal models for supporting human safety. Looking at these animal toxicity studies, a complete range of toxicity studies have been conducted in indicating a lack of carcinogenicity or reproductive effects at dose levels up to around 100 milligrams per kilogram per day, which is a dose considerably higher than humans would be exposed to on a daily basis. And this equates to roughly somewhere in the region of 40 to 80 cups of coffee per day. Looking at the acute toxicity in humans, this has been reported to be around 3 grams in young children, rising to 10 grams in adults. And these doses are equivalent to drinking approximately 28 and 93 8-ounce cans of energy drink per day, which, as you probably realize, is not physically possible. While no adverse consequences of caffeine have been linked consistently to effects on reproduction or pregnancy in humans, the Scientific Committee for Food in the European Union and Health Canada have recommended that women of reproductive age consume no more than 300 milligrams of caffeine per day. To appease these recommendations, the energy drink companies, as you know, label their products as not being recommended for pregnant and nursing mothers to highlight this specific issue. The International Agency for Research and Cancer, IARC, has also concluded that there is inadequate evidence to confirm that caffeine, as present in coffee, is carcinogenic. This viewpoint has been confirmed in several large prospective human trials. And interestingly, in one of these human trials, you can see in the third bullet point here, in that in roughly 620,000 subjects, approximately 10,000 of these men and 5,000 women consumed at least 6 cups of coffee per day, which could result in consumption levels far greater than 1 gram of caffeine per day. While caffeine has been shown to produce a slight, although transient, increase in blood pressure after following caffeine exposure, other ECG parameters are not seen to be effective. Importantly, a study conducted in adolescents demonstrates that the effects of caffeine on heart rate and blood pressure are similar to those of adults. And in fact, several recent reports, including a meta-analysis of 11 prospective studies, has proven that the effects of caffeine on cardiovascular function is not clinically significant. Likewise, for cardiac arrhythmias, this has been the subject of a considerable number of prospective controlled trials at levels of normal daily caffeine consumption, even when administered as a bolus dose in persons with arrhythmias. This was shown to be well tolerated, although conflicting reports have been found amongst consumers of coffee greater than 9 cups per day, so excessive consumers of coffee. While a number of case reports regarding seizures have possibly been linked to energy drink consumers, I believe that it is widely understood that these types of studies reports have significant limitations which does not permit or establish a causal link. In contrast, a very large, prospective, robust study, namely the Nurses' Health Study, did not identify caffeine as being a risk factor for developing seizure. Additionally, acute caffeine administration has been shown to negatively impact calcium balance and glucose tolerance. However, it has been concluded that the effects on calcium balance would be mitigated through consumption of calcium in the diet, and likewise, prospective studies suggest that caffeine from coffee protects against type 2 diabetes, again, therefore mitigating the short-term effects noted on glucose tolerance. As already indicated, the exposure analysis has shown that caffeine consumption from energy drinks in children and adolescents is low. In addition, scientific evidence indicates that caffeine produces similar effects in younger individuals as observed in adults, including effects on pharmacokinetics, pharmacodynamics, as well as dependency and withdrawal. And therefore, the effects of caffeine are considered to be more of a function of body weight and not age. And as a result of this, Health Canada has suggested that caffeine consumption from all sources by children be limited to a level of 2.5 milligrams per kilogram per day. I think it's worth pointing out here, though, that high levels of caffeine greater than those found in energy drinks are also approved for use in over-the-counter drug products for consumers aged 12 and older. And furthermore, caffeine has a long history of safe use in infants and children for the treatment of apnea, prematurity, and attention deficit disorder. I think it's also worth pointing out that energy drink products are also labeled as not being recommended for children. The GRAS determinations for caffeine use in energy drinks has also taken into consideration the potential interactions with alcohol. While it has been hypothesized that caffeine may antagonize the effects of alcohol, resulting in greater alcohol consumption, the European Scientific Committee on Food and the UK's Committee on Toxicology have reported that the totality of evidence is currently insufficient to conclude that co-consumption of energy drinks with alcohol is unsafe. The increased concerns expressed regarding the use of caffeine in energy drinks comes from a number of case reports, and these were also taken into account during the GRAS determination process. In fact, all published case reports were reviewed, including incidences of adverse events reported within FDA's CARES database. The expert panels reviewing this information agreed with FDA's position on the matter that the adverse effect report itself about a particular product only reflects information as reported and does not represent any conclusion by FDA regarding a causal relationship or association with the product or ingredient. Furthermore, the Drug Abuse Warning Network, or the DAWN report, linked to establish an increase in energy drink-related emergency room visits, was considered to have a number of limitations as reported within a recent report produced by Pioneer Associates, which again calls into question the causal relationship between energy drink consumption and emergency room visits. International regulatory opinion, including that of the FDA and Health Canada, indicate that caffeine intake up to 400 milligrams per day is not associated with adverse effects. Furthermore, the Scientific Committee for Food in Europe concluded that the contribution of energy drinks to overall caffeine intake does not appear to be a matter of concern for non-pregnant adults. So looking at the overall safety assessment of caffeine added to food and beverages, so conclusion of the safety assessment, it was found that there was really no difference in the systemic handling of naturally occurring caffeine to that which is added to food and beverages such as energy drinks. The premise that adolescents react differently to adults following caffeine consumption is currently not supported by the scientific evidence. And I think importantly here, I know we're focusing in on energy drinks, but the caffeine content within these energy drink products is either similar or below that of a number of marketed coffee products. The use of caffeine in energy drinks results in total human caffeine exposures below the 400 milligram per day level in all age groups and genders, other than for male adults. It's also, I think, this whole concern has been brought about regarding caffeinated energy drinks based on these case reports that have been publicized in the media. And these case reports and hypotheses are really not supported by the weight of scientific evidence that's been published on caffeine. The scientific expert panels that reviewed all this data therefore thought that these case reports to be of limited relevance to the conduct of a GRAS determination process using scientific procedures. And their viewpoint was that the weight of scientific evidence in combination with the exposure data and a comparison with background caffeine consumption from coffee supports safety within food and beverage products such as energy drinks. And as I just indicated, a number of food safety experts who are recognized by the FDA as being experts and therefore qualified concur with this opinion. And with that, I'd like to thank you all for your attention.